Hello, I'm Tina Jennings. Now, my first guest today is one of the only surgeons in southern Arizona who offers a technology called LINX that focuses on a reflux disease. Dr. Elliott is here with me to not only explain what the technology is, but also more about the condition as well. Doctor, thank you so much for joining us.
Thank you for having me.
So let's start with the condition. And what is this reflux disease?
So reflux is essentially a process of where the stomach and the esophagus come together. The stomach contents able to go up into the esophagus instead of staying in the stomach where they belong. There's different reasons why this happens, but essentially it's a mechanical disease where there is a valve where...
Is that what we're seeing now?
Exactly. There's a valve between the esophagus and the stomach that's supposed to keep the stomach contents inside the stomach. But when this valve doesn't work, the stomach contents reflux back up into the esophagus, letting all of those acids into the esophagus, causing damage.
Wow. And this is a great way to kind of show us what's happening underneath. Is this kind of a common problem for people?
It's incredibly common. It's actually 60% or 60 million Americans actually have this problem. That's 1 in 5 people that have symptoms and 1 in 10 people that actually have to be on medication for the symptoms. So it's incredibly prevalent.
And I know somebody in my own family that deals with this daily. Now, you did say about the symptoms. What are some of the symptoms so somebody can kind of link up whether this is happening to them?
So common classic symptoms are what people refer to as heartburn, where you have the burning, the pain, discomfort right in your chest, sometimes in the upper abdomen. That's the more classic. Sometimes you can feel things coming up into the back of your throat, that water brash feeling. Less common, but things that people don't recognize as GERD would be things like hoarseness of the voice, constant clearing of your throat, constant coughing, and also pulmonary issues. People can get pneumonia, aspiration, things that they don't even realize is related to their GERD.
And I think, like you were saying, some of those symptoms they might think it's something else. Oh, I have a cough, maybe it's a cold, or something else. So if this goes untreated because they think it's maybe just something else, what could happen?
So the constant acids up in the esophagus where it doesn't belong causes erosion of the esophageal lining. That can lead to strictures, erosions, also Barrett's disease, which is a precancer, and then coming from that is actual esophageal cancer.
Wow. So again, if you're seeing any of these symptoms, we definitely want to make sure to get it diagnosed correctly. Now, if we are diagnosed, we find out that GERD is something that we're dealing with. What are some of the treatment options? Because I did say at the beginning, we were talking a little bit about LINX.
Exactly. So we always start out with behavior modification things like don't eat close to when you're going to bed, changing your diet, taking those acids out of your diet, things like that. But those are often not long-term success. Things are difficult for people to do. And the next step from that is medication. So that's when you start talking about things like Pepcid, Prevacid, Nexium, all of these medications. And people are on those, and about $12 million a year we spend, $12 billion a year we spend on medication to try and treat these symptoms.
Yeah.
But the problem is that it's just reducing the acid in the stomach. It's not actually preventing the reflux of the acids into the esophagus.
And a lot of people don't want to be on medication every day or, having to make that a part of their everyday life. So what is this new treatment that we're talking about that could be the answer?
So LINX is an amazing new thing. It's this beautiful little magnetic bracelet that goes around the esophageal sphincter and keeps that closed so that the acids can't go up into the esophagus. The beautiful thing about it, though, is that it's individual little beads. So
Is this actually it in your hand?
This is it in my hand. So this is the bracelet, and the magnetic attraction holds the esophagus closed. And then when you eat, the little beads separate so your food can go through. And then if need be, if you need to belch, if you need to vomit for whatever reason, you can still overcome the pressure of the beads so you can do those things.
Wow.
But it keeps those acids in the stomach where they belong so you can protect the lining of your esophagus.
What's really funny is I said my family member deals with this, and they had actually looked into this because it was, like you said, something that you don't have to deal with every day. It's just there. You know that it's taking care of it. And we were saying that you were one of only a few surgeons in southern Arizona that does this.
Exactly.
And so we're very lucky that you're here and that somebody is available to do that. So how complicated is this surgery? As we were kind of looking at that diagram, how complicated is to kind of get that around there?
So it is a general surgery, but it's actually quite simple. It's outpatient procedures. You come in, you get it done, you go home the same day.
Wow.
It takes about 35 minutes. It's laparoscopic, so it's the little incisions. and it's very minimal discomfort. So people get great relief. We are having great outcomes. We have 10-year outcomes now of people having 85% symptom relief, getting off of their medications, feeling so much better.
And you said it's outpatient, we go right home. Is the recovery then pretty simple?
Recovery is pretty simple. There are some things you have to do afterwards, but pain-wise it's very tolerable and you get back to normal life.
Wow, and I know a lot of people that have been dealing with this, they've been dealing with it for years, they've been on medication for years.
Exactly.
This could be that answer that really kind of takes care of all of that. And I know for my family member, it's, you know, taken a toll on their sleep, it's taken a toll on, you know, what they can eat, they've lost weight. There's a lot of things that have come along with that.
It's exhausting, and it's something people deal with on a daily basis. The other thing is these medications, not only are they expensive, and we spend so much money as a society on these medications, they're not really intended for long-term use.
Right.
So we're seeing now things coming out about these medications being linked to stroke, cardiac disease, osteoporosis, dementia, things that we didn't know about before that are making it essentially kind of dangerous to be on them long-term, so we need a better long-term solution for people.
And that's what we have now. Doctor, thank you so much for coming and telling us more about this, and of course letting us know that it's available. And I'm going to tell everyone how they can get a hold of you.
Great, thank you so much.
Now, to learn even more about Dr. Elliott and Saguaro Surgical, just call 318-3004 or visit saguarosurgical.com.